Good evening, Borno, and welcome to another edition of the Borno Health Update. I am your host, Ibrahim Amarawa, here to shed light on the remarkable stride being made in our healthcare sector under Governor Zulum's visionary leadership. In this program, we focus on transformative efforts spearheaded by Professor Baba Malamgana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare system. Governor Babagana Umara Zulum of Borno State has made history by advancing the healthcare sector and ensuring that vulnerable individuals have access to medical services at all levels. During a recent meeting of the Chief Medical Directors of Nigeria held in Maiduguri, Governor Zulum announced a financial support of 1 billion naira to the University of Maiduguri Teaching Hospital, UMTH, to perform kidney transplants for underprivileged residents of Borno State.
The guidance of the relentless effort of healthcare professionals and teaching hospitals, and more particularly for us part of the University of Maiduguri Teaching Hospital, who have been without the storm, during the trying times of Boko Haram insurgency, and delivered high-level healthcare services to our people. We must sincerely appreciate all the professionals in teaching hospital for the dedication to patient training of health personnel and research. Today's conference provides a veritable platform to deliberate strategies and explore innovative solutions on improving our healthcare service and step the tide of foreign medical tourism in our people. I therefore urge you to engage in meaningful dialogues, leverage collective expertise and foster partnership and collaborations to chart the way forward in revamping our health sector for efficient, affordable, and qualitative healthcare delivery. It is gratifying to know that the University of Maiduguri Teaching Hospital is rising to the occasion and making headways in the provision of socialized healthcare service, which is evidence in the recent conduct of kidney transplant here in the University of Maiduguri Teaching Hospital. I was told that both patients are doing well, and the donors are also doing very well. This is landmark achievement, and I give it to patients with those diseases that have to travel far to get this service. Most importantly, those that cannot afford the cost of the transplant. The Borno State Government therefore pledges to support this initiative and is ready to provide all the partnership required to sustain the provision of kidney transplantation to patients of the University of Maiduguri Teaching Hospital and the tertiary hospitals in Borno State. To this end, I'm pleased to announce that Borno State Government will deposit the sum of 250 million naira at the University of Maiduguri Teaching Hospital to support kidney transplant of 50 patients. And this is the very beginning of the institution. More than this, and inshallah, another will contribute 1 billion naira as my contribution towards supporting less privileged individuals of the North State that don't have the financial well-being for them, for the surgery, for the transplant to be done with them. This 250 million naira will be the first phase of the project. After this initial deposit is exhausted, I want to assure you that another 250 million naira shall be provided to the partners. The Borno State Government will start already constructed and equipped the Borno State University Teaching Hospital and will soon be fully commissioned and operationalized. The state teaching hospital will complement the University of Maiduguri Teaching Hospital in the provision of tertiary healthcare service, training of health personnel and research, care service reforms, and also the establishment of eye and dental hospital in Biu and Mongolo, and the new colleges of nursing and midwifery in Yola and Mongolo will soon be commissioned.
That was Governor Zulum's there, exemplifies his slogan, everyone deserves a better life. On his part, the Commissioner of Health and Human Services, Professor Baba Malam Gana, while addressing the gathering of CMDs of Nigeria, stated that Governor Zulum is performing remarkably well in revitalizing and repositioning the healthcare system of Borno despite security challenges. Let's hear from the Commissioner.
Borno has continued to make significant investments in health sector despite the unique challenges that we've faced. With the unwavering support of His Excellency Professor Babagana Omar Zulum, CON MNI, we have prioritized the revitalization of primary, secondary, and at the brink of launching the Kashim Ibrahim Borno State University Teaching Hospital, a major step toward strengthening our tertiary healthcare delivery. This will reverse the medical tourism and will train future doctors and other health personnel in the state and even beyond. We recognize that challenges facing Nigerian health sector, such as workforce shortages, funding gaps, and infrastructural constraints are too complex to be solved in isolation. This is why we commend the collaborative spirit of this conference. We believe that the insights, the resolutions, and policy suggestions that emerge from your deliberations will go a long way in informing national strategies and guiding the Federal Minister of Health in shaping stronger and more responsive healthcare system. Let me appreciate the coordinating Minister of Health and Social Welfare, who has completely changed the trajectory of healthcare delivery in Nigeria. Through his efforts and his team, we're seeing so many changes in the healthcare which has never been seen before. We have keyed in to most of these federal projects. This morning, he has commissioned the Borno State Emergency Ambulance System. We've keyed in to the Maternal Mortality Reduction Initiative of the federal government. We have keyed in to the E-Motive project, again, to reduce maternal mortality in Nigeria. Borno State has been given free maternal drugs for years, and including free cesarean section for years, and now has commissioned, His Excellency has commissioned the Safer Birth Bundle of Care, an idea that we borrowed from Tanzania, where maternal mortality and newborn mortality were reduced 75% maternal and 45% neonatal. So we look forward to deeper collaboration between federal and state institutions, particularly in the areas of workforce training, research, and the integration of service delivery. Borno is open to partnerships and innovation, and we welcome all ideas that can enhance well-being of our people. Borno has started digitizing health institutions. We have digitized primary health care and the specialist hospital, and this is just the beginning. Our midwives have started doing ultrasound scans with a view of reducing maternal death. One such visit recently, the midwife told me she diagnosed placenta previa, which means an abnormally sited placenta, and therefore that woman can be saved by delivery in a hospital. Distinguished participants, as you engage in meaningful discussions over the course of this conference, we encourage you to take a moment to experience the renewed spirit of Maiduguri, a city that is rising from its past with strength, dignity, and hope.
As the Commissioner of Health, Professor Baba Malam Gana always emphasized, crashing maternal mortality in Borno requires multifaceted approach. The state's Ministry of Health introduced numerous programs such as SEPA Bundle of Care Program, the Maternal Mortality Reduction Innovation Initiative, MAMI, Government Supported Program. Now, the State Emergency Medical Services and Ambulance System, SEMSAS, is now fully operational. It could be recalled that Governor Babagana Umar Zulum recently launched 10 brand new ambulances for Borno State Emergency Medical Services and Ambulance System, SEMSAS. Apart from ambulances, all other necessary facilities have been provided for the program to kickstart in earnest. Speaking at the capacity building training for ambulances drivers and paramedic personnel, the Commissioner of Health and Human Services, Professor Baba Malam Gana, represented by the Permanent Secretary of the Ministry, Dr. Shatima Maina Muhammad, lauded Governor Babagana Umar Zulum for always responding to the healthcare need of the Borno people.
I appreciate your presence for this very important capacity building workshop for state emergency medical services and ambulance systems. This training is a milestone in the operationalization and takeoff of SEMSAS in Borno State. SEMSAS is an important institution that has its roots from the National Health Act. The National Health Act provides for what we call the Basic Healthcare Provision Fund to provide accessible and affordable healthcare to the entire citizenry of Nigeria. 1% of the consolidated revenue accruing to the Federation is dedicated for the Basic Healthcare Provision Fund. And in implementing this Basic Healthcare Provision Fund, we have what we call the gateways. These gateways are known to most of you. The most popular one is the Primary Healthcare Development Agency. The fund supports the activities of Primary Healthcare Agency, which is the basic healthcare that brings healthcare service at the doorstep of every community, and more particularly the local government areas. And the second one is the contributory healthcare agency or health insurance. Now, we are all aware that Boshima is existing. The one has been lagging behind is the emergency medical care and ambulatory system. And it is gladdening to note that His Excellency the Executive Governor of Borno State, Professor Babagana Umar Zulum, CON FNSC, has approved the takeoff of SEMSAS in Borno State. He has approved the takeoff of SEMSAS in Borno State, and he has supported the takeoff of SEMSAS. So, the relevance of SEMSAS in the provision of healthcare cannot be overemphasized, because it deals with the provision of emergency healthcare service, which is very important, especially to us in this part of the country. We are heavily burdened with insurgency, and one of the emergency services we have in the SEMSAS is pre-treatment for gunshot wounds and so on, and for people that have victims of IED explosives. And again, one of the major relevance of SEMSAS is its impact in crashing down maternal mortality, because these ambulances are specifically meant to convey pregnant women to the nearest health facility when they are in labor. One of the major causes of maternal mortality is postpartum hemorrhage, bleeding. Women usually die of bleeding before they access healthcare, before they go to the facilities at home and so on. So with this system, it is just for you to call the toll-free line, and nobody is charged for the calls. An ambulance will be at your doorstep and convey that pregnant woman to the nearest health facility. And again, we have our own paramedics that will accompany the ambulance. And we have to sincerely thank the Primary Healthcare Agency for deploying this staff to us, who will provide emergency healthcare right from that point of accepting the patient up to the delivery of that patient to the nearest health facility.
That was the Permanent Secretary of the Ministry of Health, Dr. Shatima Maina Muhammad, during the training of the emergency personnel. Also shedding more light on the expected impact of the medical emergency and ambulance system. The program coordinator, Dr. Muhammad Dauda, said this initiative will address the issue of delays for pregnant women in accessing hospitals on time, especially during childbirth, which will end maternal mortality during childbirth.
This is one of the interventions being programmed here in Borno State. Borno State were opportune to be onboarded for this SEMSAS very important activities here in Borno State. First of all, we have to thank His Excellency Professor Gov Zulum for this very important initiative being here designated here in Borno State. It's an opportunity here in Borno State to have this very important office, which is one of the offices being identified at the national level to say that each and every state in Nigeria to have the state emergency ambulance services to reduce the delay in terms of taking our mothers from the community level to facility level in terms of the maternal mortality reduction here in Borno State. The aims of this object activities is to reduce and crash maternal mortality in Borno State by taking our mothers without any delay. Without the second, we see our ambulances at the doorstep of our mothers to take them from the community to facility level for efficient activities and intervention at the facility level. For this training, is one of the training being applied here in Borno State. That's the training of the paramedic and the ambulances training to identify. We identify these drivers, professional drivers, to see that they will work hand in hand with the government in terms of the taking our mothers from the community level to facilities. These drivers are well trained, and we are here. We're opportunity to have the Road Safety Commission here with us to support us in training these very important people. And we also identify the paramedics to support these activities. We were opportunity to have 15 paramedics here to be stationed in each of the ambulances here in Borno State, and we identify locations, and we cluster the locations for each and every ambulances to be stationed, with two paramedic being stationed in the ambulances for day-to-day activities. We have to thank His Excellency first of all, because this is one of the opportunity Borno State been enjoying. Because a lot of states in the country, like Yobe now, they have their own agencies called Yema Boss, and they are fully implemented these activities. And Borno State were opportunity to have this very important unit to start this operationalization of the ambulance service. And we are sure that But the caliber of people and the professionalism of people we have here will deliver what we are expected to do, so by the grace of God.
Thank you for joining us. Stay tuned for next week's update, where we will explore more innovations in the healthcare sector. This is Ibrahim Amarawa reminding you, health is wealth, and Borno is on the rise.